All right, so for the next approximately 11 slides, we are going to be discussing how we create bone, specifically from cartilage. So think growth spurts. So one of the things we need to be aware of is that certain bones, frontal, parietal, temporal, and occipital bones specifically of the skull, the facial bones, the clavicles, the pelvis, the scapula, and part of the mandible, are all going to be formed by a process that we actually refer to as intramembranous ossification, which is going to be different from other types of ossification. Essentially, what happens is that these particular structures are going to be contained within a fibrous membrane made of embryonic connective tissue called mesenchyme. This membrane is going to help the cells form their shape, but it's not hard yet. It is soft, it is squishy. If you've ever held an infant and felt their clavicles or their scapula or their skull, it's soft and squishy. It's because it's not bone yet. Not really. So this is the process by which we're going to go from, let me fix my slides, there we go. We're going to go from this collagen cartilage pre-bone to actual bone. So first of all, the cells within this membrane are going to cluster. They're going to secrete these same organic compounds that we're going to find in our bone matrix, in all of our bones, so the calcium, phosphorus, collagen fiber complex. This is going to become mineralized to form crystal, calcium salts. This is called calcification. As this calcification occurs, these mesenchymal cells are actually going to differentiate and become osteoblasts. So they're going to become cells that actually are going to form bone as we know it. The location in these particular bones where this ossification process occurs and is going to come out from is referred to as an ossification center. A frontal bone, parietal bone, occipital bone, they can have many ossification centers, unlike our long bones, which typically have 1 to 2 at each end. These bones will have many scattered throughout, and you will get ossification occurring and spreading out until ossification centers meet. So osteoblasts, some are going to get trapped within bony pockets, so they're not going to be able to keep spreading out. These will become just good old standard osteocytes, the ones that maintain a equilibrium. They're not building, they're not breaking down, they're just maintaining. So this bone is going to spread outwards from the ossification center in small struts that we refer to as spicules. Think of them as little spikes coming off. They're going to, the mesenchymal cells are going to continue to divide to form additional osteoblasts. Now we're making tissue here. So this is going to require oxygen and nutrients. So we're going to trap blood vessels within these spicules and these spikes so that we have a steady supply of oxygen and nutrients to these osteoblasts. And when this happens, this will actually cause the blood vessels to... That was loud. Note to self. All right. Sorry about that. Lost my train of thought. The branches of the trapped arterioles and capillaries will, or the vessels, will branch off and form new capillaries and arterioles and venules to supply the area. So once they're trapped, they'll actually be like, hey, this area needs blah, 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 and create what is needed for that. We actually see this happen all the time in our body right now. This is one of the concerns with cancer cells, is that they cause the body to form new branches of arteries and veins to bring nutrients and oxygen to the cancer cells and take away waste products. So the cancer cells trick the body into keeping it and feeding it, allowing it to grow. In this particular instance, this is not detrimental to us. This is actually super beneficial when we're talking about the creation of bone. Now, initially, this bone matrix that we create is just going to be spongy bone. We'll talk about spongy bone. So we have talked about spongy bone in an earlier audio. Just spongy bone to start. As this spongy bone forms, becomes what it needs to, it spreads out, it's beginning to really take on the shape of what it is going to be, like the bone that it's going to be. We're going to get additional remodeling happening around these trapped blood vessels, and this is going to allow us to form osteons, which will then allow us to form compact bone. Remember, osteons are going to be the cell shape and structure for our osteons. Or our osteons are going to be the cell shape and structure of our compact bone. But eventually, this rapid growth, this rapid formation of spongy bone and then cortical bone or compact bone is going to slow down. The connective tissue surrounding it is going to reorganize itself into the fibrous layer known as the periosteum. Remember that outer membrane? The osteoblasts that are actually right on the edge of the surface, when this final slowdown and reorganization happens, are actually going to become that inner layer. So everything is just going to slow down, reorganize, and become what we talked about earlier when it comes to bone structure. Now, if I'm talking about other bones, most other bones in the body, they're actually going to do something called endochondral ossification. Endochondral, there was no I. Ossification, meaning where the bone is going to be eventually will temporarily be hyaline cartilage. So when I am 8 years old, the ends of my femur aren't bone, they're hyaline cartilage. And when I undergo my growth spurt, it is a race between the formation of hyaline cartilage to extend my femur and that hyaline cartilage becoming bone. Hyaline cartilage ossifying. When the hyaline cartilage loses, when the ossification process catches up to it, that is when the bone is done growing. Get into that in more detail. But most bones are by this particular model. It is more complicated than intramembranous because we have to first have the hyaline cartilage. We then need to break down the hyaline cartilage during this ossification process. So it does involve more steps. So we're still going to have our mesenchyme. Our mesenchyme cells are going to create cartilage. Specifically, it's going to form chondrocytes near the center. They're going to increase in size. As they enlarge, they're going to form lacunae, and they're going to reduce their matrix until they become thin struts. These struts will then eventually begin to calcify. This will deprive the enlarged chondrocytes of nutrients, since diffusion cannot occur through calcified cartilage, and they'll die and disintegrate. Eventually, though, blood vessels will grow into the tissue surrounding the shaft of cartilage. These cells of the inner layer will then become differentiated into osteoblasts. The layer, the membrane surrounding that cartilage, will become periosteum, and it's going to produce a thin layer of bone around the cartilage, providing a bony collar of support. And then we're going to get more blood supply. We're going to get fibroblasts to create fibers migrating into the heart, invading the spaces, breaking down the cartilage, creating osteoblasts, replacing it with spongy bone. From there, that center spot will become the center of ossification and spread outwards towards both ends. As long as the diameter is small, the entire bone will be spongy bone. So, just spongy bone. Here we have a fetus, and if you look at the thigh and you look at the forearm, you can see primary ossification centers for these particular bones. They're super small. There's not a whole lot going on. There's not a lot of these guys. We have some going on in the ribs. We really don't have much ossification going on. This guy is mostly cartilage. And this is a good thing, because if we were bone when we were born, we would not fit through the birth canal very well. All right, so that primary ossification center is going to enlarge towards both ends. Osteoclasts are going to break down the spongy bone and open up the medullary cavity, the center. This is going to allow for bone marrow. As these osteoblasts move towards the epiphyses, the ends, the cartilage at the epiphyses is going to continue to grow. This is going to allow the shaft to get longer as long as the ossification centers don't catch up to the epiphyseal cartilage. When it does, you're done growing. So images of this. For me personally, I am much more of a visual versus a word learner when it comes to the stages of endochondral ossification. I much prefer to visualize it. So here you have a visualization of that formation of the bone collar, deterioration of the cartilage matrix, blood vessels invading, transforming it into spongy bone, extending towards the epiphyseal plates, where we will get secondary ossification centers at each end, and eventually the epiphyseal plates will end up becoming ossified as well, and we'll have all bone. All right. Around birth, so if you make it to 40 weeks, most long bones have a bony diaphysis, tiny little bony diaphysis, surrounded by remnants of spongy bone with a widening medullary cavity and lots of cartilage. You're going to, once you're born, get lots of capillary and osteoblastic migration into those cartilage epiphyses, and this is where those secondary ossification centers become. Slowly, the epiphyseal cartilage will be transformed into spongy bone. However, there will always remain a small cartilaginous plate until you're done your growth spurt, and this is called the epiphyseal plate. It will remain a juncture between the epiphyses and the diaphysis, and this is where we will get our expansion of the diaphysis. This is the guy that will remain cartilage and try and outpace the ossification process. This is where we get our growth spurt. And that's the basics of the creation of bone. So our next audio is going to be very, very short. It's going to be a continuation of this, but also talking about remodeling. So if I break my bones, how does that happen? Or how do I fix that?